Good morning, everyone. We'll get started in just a minute. This is our first breakout session of the day, so welcome. This is track 1, Living with a Life-Altering Condition, and it's sponsored by Horizon Pharma. We would also like to thank Alliance RX, Walgreens Prime, for sponsoring the networking break this morning. My name is Emily Kelly, and I will be your track host for this morning's session. I would also like to remind those of you who are joining us remotely through the live stream and welcome you all, and would like to remind everyone joining us to download the mobile app in order to use some of our highlighted features like the Q&A that's live. So today we're going to hear from Kimberly Bower, Chief of Division of Palliative Medicine at Rady Children's Hospital and Medical Director of the Pediatric Program at Scripps Hospice, Caroline Loewy, co-founder and board member of KCN-Q2 Cure Alliance, and Hilary Savoie, founder and co-executive director of the Cute Syndrome Foundation. Oh. This session, Looking for Answers in Uncertainty, Managing When There Is No Diagnosis or Prognosis, will explore challenges that can arise when you have a missing or minimal diagnosis and how you can strategize and manage these obstacles. And with that, I will turn it over to Kimberly to get started.
Okay, well, thank you for that nice introduction, and thank you all for being here today. As we said, we're going to talk about, oh my goodness, interesting. I'm looking up at the slides, and all the pretty pictures that I had on the slides are not showing up. Okay, so we're going to have very white slides today. So the topic of this presentation is how do we manage, how do we deal day to day and over the long haul with people that we love, with our children, with a disease that we have ourselves, with somebody who we love who is experiencing a medical condition or a medical challenge when there's uncertainty. And in the title, we talk about uncertainty around prognosis. So the children, for example, who are totally undiagnosed, where we know that there's something wrong, there are symptoms or things that are showing up, but we can't figure out why. So that's one type of uncertainty that I think is particularly challenging to figure out how to live with and how to manage through. But there are lots of types of uncertainty that people deal with when they're in the medical system. There's uncertainty around prognosis. So even if I have a diagnosis, how is my life going to change because of that diagnosis? How is my underlying medical condition going to progress, or is it going to progress? Or how is this going to affect my job or my child's school or whatever else I'm experiencing? And then there's uncertainty around treatment. So you might have a treatment that you've chosen, and you might start down that treatment path, and there's a question of will it work, or will I have side effects? Or you may be trying to choose between 2 clinical studies, both of which are in the early phases, and you don't know which one to choose, and how do you come to terms with that? And when you make a choice, how do you prevent looking back and regretting and second guessing, and should I have made a different choice? And then, finally, even if you choose a certain treatment and it works, and you get the symptoms stop progressing or the disease goes into remission and you're very excited and in a good space, still in the background, there's that uncertainty of, will this ever come back, or will the symptoms start progressing? So what I have seen in my practice is that families have just challenges. It's just something, that uncertainty is something that's always in the background that they're thinking about and aren't always sharing openly with their medical providers. And on the slides, we really had the slide set. There should be a picture here, and it's a quote from Christopher Robin. And I'm not going to be able to probably reproduce it, but it basically says, you are brave, you are smarter than you think you are strong. So you're brave, you're smart, you're strong. And I think as we go through this presentation, those are the characteristics that we're going to talk about. So this is a quote from The Still Point of a Turning World. This is a book that was written by Emily Rapp, who's the mother of a child who had Tay-Sachs disease. And what she says is, parents don't need consolation. What could possibly console? parents need the tools to walk through the fire without being consumed by it. And I think this is such a powerful quote and such a powerful image. And I think the reason for the session today is to talk about what kind of tools you do need to manage in uncertain times, and what have other people who have gone through uncertainty experienced, what have they found to be helpful. So I'm going to talk about the medical literature and where things stand and what we know about coping with uncertainty, and then we're all going to sort of share our experiences and our stories. And we hope also that all of you will share your experiences and stories, and the hope is after this session you'll walk away with some tools that you didn't have before you came in. So the first study may not seem like it's totally related to uncertainty, but I think as we go through the presentation, we'll see how it does tie in. So what I will first say is there's not a large literature on how parents deal when there's not a diagnosis or when they don't understand the prognosis. So this is just a survey that looked at 107 parents whose children were in the hospital. Now, these children had to be in the hospital for 3 days, but they weren't the sickest children. They weren't children in the ICU or who were really critically ill. These were kids that went in and out of the hospital pretty quickly. And what the study found was that 32.7% of the parents surveyed 3 months after the hospitalization had some degree of post-traumatic stress symptoms. And 21.5 had scores consistent with probable post-traumatic stress disorder. Now, this is something that we don't talk about as a medical community. We know that being in the hospital is stressful for families. We know that they go through a lot, but we don't label it this way. And I think in not acknowledging how stressful a hospitalization of a child can be, we don't realize that the children that have chronic and complex medical conditions, they're in and out of the hospital all the time. And the responses that parents or patients may have when they come into the hospital may be related to that current hospitalization, but they may also be reliving some of the trauma or some of the most difficult times that they had in that hospital in the past. And because we don't talk about it, we don't have great ways, I think, to support parents and to help them in those situations. Now, when you look at genetic counseling literature, this is where most of our information comes about how do parents cope when there's no diagnosis, when you know something's going on, but you don't know exactly what it is. So just in the last 2 years, I'm going to show you a study from 2017 and then a study from 2018. So in this study, the first study, again, it was a survey of parents whose children were undiagnosed. And what they found was 40% of parents experienced either anxiety or depression, which is a really, really high percentage. They also found that when parents weren't taught or given skills for coping with what was going on and the uncertainty, then their rates of anxiety and depression were higher. They also found that parents who had a longer time between diagnosis and the time the survey was being given, or who had older children, their rates of anxiety and depression were lower. And probably that's because they had a longer time to develop skills and learn how to live and enjoy life and manage, even when they didn't have the answers that they were hoping for. So what were the benefits? Like, why did parents say it was so important for them to have a diagnosis? I have found in my own practice that most of the families that I take care of, when there's a child that doesn't have a diagnosis, it's a major cause of distress for the family and a major thing that they focus on in terms of taking care of their child. I wanted to tell you just one story here. So I have a 20-year-old patient who I take care of who has an undiagnosed disorder that's caused her to very slowly lose some of her neurologic function. So at this point, she's in a wheelchair, but she's cognitively intact and she can talk, and she goes to college. I met her when she was about 15 years old, and we talked about how much she wanted a diagnosis. And when I talked to her about, well, what do you think, how would having a diagnosis help you? what are you looking for in having that diagnosis? What she told me is, I need a community. I'm isolated. I don't have anybody else who's like me, and I'm a teenager and none of the other teenagers are like me. I need that community. And we went down the road a couple more years, and of course genetic testing keeps progressing, and she had more genetic testing, and they said, we think we might have a diagnosis, but we need to do more testing and find out. So of course she got the name of the diagnosis, and the first thing she did was get on the internet and look up and read about it, and I thought, oh my goodness, they gave her the diagnosis, and this does not have a good prognosis. Most of the people diagnosed with this condition end up dying, and I'm afraid she's going to see that, and she's just going to be beside herself. And she came in and talked to me and said, I'm so relieved. The emotion that she was having was not anxiety and sadness, it was relief. She said, I don't care. I mean, I care that this may mean that my life will be shortened, but it's such a relief to know and to have a community. Unfortunately, that didn't end up being her diagnosis. So it was sort of given to her, and then it was all taken away. So advance another year or so, and we talked again about the uncertainty and whether she was still, because she does tend to want to have any test that's out there that might give her answers. And we talked about, is it still important for you to have that diagnosis, and how would it benefit you? And she said, at this point, I think I've come to terms with the fact that I'm never going to have a diagnosis. I'm never going to find other people who are exactly like me. But I really still want a diagnosis because I want it to have my name on it. And I want to have a legacy. Like, forget putting the doctor's name on it or the researcher or anything else. I want it to have my name on it, and I want this legacy. I want people to remember me and remember who I've been and the contribution I've made and what you've learned from my genetic testing. So when you look at these reasons that parents say they want a diagnosis, they say, well, it helps us in determining a treatment, which makes a lot of sense. It helps us predict prognosis. We have a name for our condition that we can, tell people, and we can access support networks that are specific to the condition that our child has. I think the one that always stands out to me is this acceptance by others. But what I have found, I don't know if any of these is more important than another, but I think this acceptance is very important. What I have found when a child is not diagnosed, it's easier for the medical community to question, like there's a new symptom. Well, is it from the underlying condition? Is it from something else? Is it being over-reported? And it's also easier when you're trying to get community resources, services from schools or from community agencies that might provide support. If you don't have a name, it seems to just sort of be some kind of a psychological barrier to other people accepting what's really happening with the child or patient. So this is another study. So that last study was just from 2018. It just was published recently. This is a 2017 study. This is the last study I'm going to show you before we really get to the good stuff and hearing from parents who have actually been through experiences. But this was a survey of 62 parents of children with undiagnosed medical conditions. And what they did in this survey is they actually compared them to parents who had children who had diagnosed medical conditions, sort of same severity, same symptom, same type of symptoms, but parents who had a diagnosis versus parents who didn't have a diagnosis. And what they found was just not having a diagnosis decreases, the parents who didn't have a diagnosis had lower hope, lower perceived social support, and fewer ways to manage and cope with the situation. They also found in this survey that parents were really dissatisfied with the medical field, the medical profession. So parents who didn't have a diagnosis were often not very happy with the medical care that they were receiving. And this has sort of been my experience when I look at parents who have a diagnosis versus those who don't. And this is not going to be true for everyone, of course. And I hope Lots of you are having wonderful experiences with your healthcare providers, and I hope we're getting better. But this is a pretty recent study, and it said, parents felt like the communication wasn't good, there wasn't adequate support, there was dismissal of their concerns sometimes, which is sort of what I was alluding to with the feeling judged or not believed or not fully acknowledged. And then that there was a lack of knowledge. And when as a healthcare provider, when you don't have a diagnosis, there's a lot you do know, but then there's probably even more that you don't know. And what did parents want? What was a remedy to this? Well, the interesting thing is what parents wanted were really simple things. They wanted to be acknowledged as the authority on their own child's health because they live with them every day. They take care of them every day. They know that child better than anybody else. The doctor might know the big picture, but the things that are really specific to that child, really the parents are always the experts in that. And they wanted the provider to demonstrate empathy. So just like the keynote speaker talked about today, they wanted to be heard and understood and for people to acknowledge what they might be going through. So in this study, they also went one step further, which were to say, are there any skills, is there any advice that we can give to parents that might help them cope? And so they looked at lots of different factors, and they said, which of these factors are associated with decreased anxiety, decreased depression? Which ones are really protective and helpful to parents? And what they found was strong social support, and I bet you all, being at this conference, this is your group and community. Hopefully this is where one place at least that people can get that type of social support. So in all my experience, that has been a number one thing for me as I've watched people walk through difficult journeys with their children. The thing that sort of surprised me that I had never thought about was affection. So people who are more willing to accept hugs and physical affection tended to cope better and have less anxiety and depression. And if you believed that you could cope, if you in your core believed that you could cope with this and that there were things that you could do and you had some control, then there was less depression and anxiety. And that's why I had the Winnie the Pooh quote that I might have to search it on my phone while we're sitting here. If you search it, it will pop right up. But it's like, you're braver than something you are, you're smarter than you think you are, you're, yeah. And maybe that will be the one thing you take away today is put that quote on your mirror and tell yourself that each day. Give yourself that affirmation. Okay, so I'm going to turn it over to Hilary to talk a little bit about her experiences. Yep, I can click for you.
Hi, everyone. So my name's Hilary Savoie. I am the mother of a little girl who will be 8 in the not-so-distant future. Her name's Esme. This is her. Esme has 4 separate genetic mutations on 4 separate chromosomes that were found slowly over pretty much a 4-year process. And many of them, the designation of whether they are considered to be pathogenic or not has changed over time. So Esme is, in many ways, despite having 4 diagnoses, is less diagnosed ever than she has ever been now. And a little bit about Esme. She is extremely funny. She loves the Muppets. Biggest Muppets fan ever. She has extremely low muscle tone. She has, that resulted in her difficulty swallowing as an infant, so she had cardiac and respiratory arrest at 3 months old. She's been entirely fed by feeding tubes since then. She has anomalies in her heart and her kidneys. She is functionally nonverbal. She is non-ambulatory, although she crawls like you would not believe really quickly as soon as I turn my back. And she can pull to stand mainly to get into things she's not supposed to get into. She has a wicked sense of humor. And at the age of 4, we realized that she had taught herself how to read. And we don't know how she did that because we certainly didn't teach her. So Esme, her being functionally undiagnosed has been extremely challenging in a number of ways, in being able to provide her proper care, in getting people to take us seriously when we have problems arise, and in finding community. It also has allowed us, in a way, to see some poetry in that and to decide that the lack of prognosis and the lack of diagnosis means that no one can tell us what's possible and what's not possible with Esme. And that's something that I believe very strongly, and I believe even if someday she has a clear diagnosis, no one is ever going to tell me what she can and can't do. And certainly no one's going to tell her what she can and can't do. When she received her first diagnosis of a mutation in the gene PCDH19, she was about 2 years old, and I started a foundation called the Cute Syndrome Foundation. The name came from the fact that before we had any diagnosis, people would ask me what was wrong with her, and courtesy of my friend Dana, we had come up with the fact that she had the cute syndrome, and that was what she had, and that was what I would tell people when they would ask me what was wrong with her, because, well, she's really cute. So I started the foundation. We started funding research for PCDH19. We got about, a little over $100,000 in, and bam, that diagnosis was sort of withdrawn, and another one was inserted in its place, SCN8A. And we began working on SCN8A as a foundation at that point. And then she has had 2 separate diagnoses since then, in a mutation in TBL1XR1 and MAP3K7, both of which are the most likely pathogenic of the series. So the foundation has worked on the 2 less likely pathogenic. So I think the uncertainty with Esme, as I started this foundation, I did what most people do when they start foundations. They get a diagnosis and they say, I'm going to start this foundation and I'm going to find a treatment for my kid. And there's a lot of hope and a lot of energy behind that. And I would not take back my journey. I think we created hope and possibility for a lot of other kids, just not my kid, in the PCDH19 community and then in the SCN8A community. But my daughter is unlikely to benefit from that. And so with that change and that sort of shifting ground, I feel like we live on like a teeter-totter that moves in all directions and goes up and down at the same time. I've really tried to move toward doing a lot of work that speaks more generally to the rare disease community and more generally to life being undiagnosed and having an unclear prognosis. So in addition to my work with the foundation, I have written a couple of short books, short memoirs, one about her genetic journey and the other about her cardiac arrest. And I'm a features writer on romper.com, where I write about a lot of issues that pertain to moms raising children with rare and complex medical or developmental issues. And currently I'm actually working on a series about caregiver PTSD that I think is so important and so misunderstood. And that's really a big passion of mine. I think, like I said, I think that Esme's lack of prognosis, it has been incredibly, and diagnosis has been incredibly painful and difficult, and has sort of challenged me to the core. But there's also a lot of poetry there. And I often say to people that when I found out I was pregnant and I was expecting a child, my plan was to prepare this little person for the world, to teach her how to be a grown-up in the world and how to deal with the world. That's what we do as parents. But that isn't what I do as a parent. And what it has been is that my daughter has been teaching me, and the things that I'm learning from her are enabling me to try to change the world to be prepared for people like her, to be friendly to people like her, to see the beauty in people like her. And so that's really been my reaction to uncertainty has been to kind of lean toward it, to embrace it. And it's really Esme, and actually I think there's another slide of her. It's Esme who drives it. And that's actually her in August at the National Dance Institute. She took a Dancers with Disabilities workshop that we weren't sure she would be able to do. And like many things, you know, we thought, well, maybe she'll do it for an hour or two. She was the youngest child to ever get through a full day. And she stayed the whole week, and she performed, and she followed the choreography. So she is, just reminds me time and time again that anything is possible. So that's us.
Hi, so I'm Caroline Loewy, and I'm James's mom. This is James when he was born. He's now 13. And there's so many things that the other speakers said that really rang true about certainly our journey through this. And I really do believe, as Hilary said, that these children have so much to teach us and the world around them. It's pretty remarkable. So as far as uncertainty, this kind of sums up our first days in the hospital. James was born sort of without event, great APGAR scores, everything was wonderful. And within, I think about the first 12 hours, he immediately began having seizures and really turned the whole situation upside down. In terms of the PTSD that Kim mentioned, trying to think when it was, right around this time when he was first started having the seizures, we were doing CAT scans, EEGs, and he ended up in the NICU. One of the doctors asked my husband if I needed to be sedated. So certainly, you know, not your typical firstborn kind of situation, and really threw everything to a loop. And you know, one thing, and I talked to Kim about this earlier, it's interesting, our situation really started from the worst possible outcome in the first day of thinking he might not survive through the week, not knowing what he had. And then really things started turning more positive from there. So it's a little different than the kind of experience many people have where they have given birth to what they think is a typical child and then things decline. But in our situation, really went from probably a very negative outcome to things turning around. At that point in the hospital, we went through many, many tests for everything that was available in 2005. All the testing was not that advanced at that point, and many one-off gene-by-gene tests to the extent any genetic testing was available, any kind of infections that might have caused this, looking at possible birth trauma and things like that. And then by the time we left the hospital with seizures, being told that don't worry, he'll still go to Yale, and no reason to be stressed out, everything would be fine. Lots of kids have seizures in their first days of life and outgrow them, and everything will be fine going on from that. So this is kind of where we were in the in-between times. You know, when he went home from the hospital, we went on with life as normal. And it's interesting, the thoughts of uncertainty really being a negative. We didn't have a diagnosis, but who knows what caused this? This will be fine. We went out to restaurants. He was on all sorts of anti-seizure medications, so was very sleepy. We just tucked his little carrier under the table at dinner. You know, we're able to we traveled with him because he was the easiest baby ever because of the sedation from the anti-seizure medications, and went on with our lives. I got pregnant again right away with his sister because, of course, this isn't anything major in genetics, so it'll be fine. And fortunately, it is not inherited, but at the time that wasn't known. We started baby swimming at 6 months because I'm a swimmer. That's what we do with any kid. So I think in a lot of ways, there's different sides of the uncertainty. And Hilary touched on this a little bit too, without a diagnosis or at least a prognosis. As far as we knew, anything was possible, and we went through as if that were the case. We put him in the swimming pool. We didn't treat him like he was so fragile, even though, I mean, that was a remarkable moment where he was able to hold his head up. Even getting to 2 to 3 years, he'd had very poor head control, especially with a very large head. But things went on, and as the months passed, and he still wasn't meeting his milestones in that first year, we came up with more things to test for, kept in front of the doctors, and probably because my background, my husband and I are both in the biopharma industry, of thinking, there is an answer for this, and we will find it. So as it became apparent that his delays were more significant, we kept on going back to the medical community, back to more testing, that there has to be some kind of definitive answer for why he still wasn't walking as he was turning 3, why he still was having problems with the seizures over the years. And so we kept searching for an answer within that and undergoing testing. That's probably different than what a lot of people I know become sort of frustrated and give up, that there isn't an answer out there. But that's just, from my personality and probably from my career background of thinking there must be a way to figure this out. So this just ugly graphics, but kind of the timeline of where we were. So he was born in 2005, and as I said, at that time there was very limited testing. We got all the way through, exhausted all of the testing efforts. We live in San Francisco, through UCSF and Stanford, some of the top institutions, contacting people at Harvard and Johns Hopkins, really all over the country in the top centers, finding nothing over that time. He started walking, very delayed on all of his gross motor functions, which still are his strong point, and even those were dramatically delayed. We went to the NIH Undiagnosed Diseases Program, which is oftentimes sort of the pinnacle of an undiagnosed journey, as they allow you to we spent a week at the NIH undergoing every single kind of test imaginable after our physicians had proven that we'd done everything we could locally. And while it was really satisfying to have that complete scrub down of his heart, we had muscle biopsies, nerve conduction studies, every possible test, to know that there wasn't something else lurking in there that we weren't even seeing yet, but still did not turn up an answer. And it was only just during the later part of that year in 2012 that the first paper was written identifying this gene KCNQ2, which is K for potassium, CN for channel. It's a mutation on a gene that codes for the potassium channel on the neurons. So that gate that controls the electrical signals sent throughout the body is malformed and doesn't function properly. So that affects everything. That electrical activity causes the seizures, but it also limits the children's ability to walk, talk, think, understand things. Really, every part of life is affected by that. When you move your arm, your brain is saying move your arm, and that signal isn't coming through clearly because of this disease. So that KCNQ2 encephalopathy was only discovered in 2012, so it was really unknowable. So in all those intervening years while we were undergoing testing, and even had some hints over the years that he might have one thing or another. He was on a low protein diet because they thought he couldn't have metabolized proteins, different metabolic disorders, but finally found what it was, and several months later he was diagnosed. And we entered a community then of about a handful of patients who had been diagnosed at that point, and finally had found our community. In those intervening years, actually in 2008 when Global Genes was started by Nicole Boyce, I had met her through some friends and joined the board of Global Genes, and that was my group. So I think, really it is important to have a support group, and we knew all along it was something ultra rare. And so, as Hilary mentioned, focusing on just rare disease overall at this point because of their multiple genetic mutations, Global Genes really was my group for rare disease at that point until we found this specific diagnosis for James in 2013. And then joined together with some of the other parents and formed the KCNQ2 Cure Alliance that's been working on research and bringing the community together. We now have over 500 individuals in our Facebook group. For our family, we held our 5th annual summit with experts and leading researchers, have a natural history study. We have gotten pharmaceutical companies interested in developing drugs for this disease, even with that number, because it's believed there's probably thousands of patients out there with this being so new. And I think that's one thing with not knowing if there's other patients out there, if the gene is only recently discovered, or if it's difficult to identify, that there probably are lots of other patients out there. They're just not being diagnosed, and that visibility and knowledge of the disease is really important. And what we hope, and just kind of aspirational on this timeline, is that there's one of the companies developing drugs for KCNQ2 may enroll their first patients in a clinical trial next year. So from this progress of not even having the gene discovered and knowing, we've made great progress, but there certainly was, a lot of uncertainty along the way, but just kind of continuing on a quest for knowledge through that. So this is James now. He could have cute syndrome too, we don't know. But I think the uncertainty, as I said, not knowing, there have been points when they thought it could be something that he would, could pass away by the time he was a few years old. Certainly for years they said he would never walk, but not knowing what he had, I think that uncertainty, maybe it's the glass half full approach, that it can't limit you, it can't be defined, you're not putting a label on it, that, we tried, he skis, he started out in the sitting ski and, moved his way up, and now this past year he actually skied without a harness. He can't speak, you can't tell him to turn, he doesn't understand that. He has a couple words he understands, cookie and step and sit, but if you ski in front of him and clap and cheer and sing, he manages to shift his weight to turn himself towards you. He loves the water and swims, he's incredibly happy, but I think in terms of turning the uncertainty into something positive as you're going through that journey, it's certainly frustrating. And I think the other thing is, I consider myself, I'm a planner and kind of very focused on facts and things like that. You control what you can control. I've always tried to work outside the home, at least even if it's only sometimes, because that's an environment you can control. There's rational people, it's understandable, or have something. And even informing our foundation, I can't necessarily make James better, but there's steps that we can take in that are helpful and controllable, that have really been a huge benefit, aside from joining with other families that have the same disorder. And this is a number of the other children that with KCNQ2, this was our recent conference. And that's James in the back, as you can see. I mean, obviously very fortunate that he's able to stand and walk, but just a wide variety of outcomes. So even with the diagnosis, that's probably one more thing to note, that it's not clear necessarily what the prognosis is for the children, as you see a wide variety of outcomes with these children.
And for telling us about James and Esme. I think what we are going to do, we have about 20 more minutes. We were going to do 15 minutes of a sort of question and answer, and I was going to ask some questions, and Caroline and Hilary are going to ask me some questions, and the audience too, if you have questions, we can bring the microphone around. And then for the last 5 minutes, we were going to try and do just some takeaways, like what from what you've heard, what tool would be most helpful to you as a parent, or what lessons could you take away from the session? So that's, I think, the structure of the rest of the presentation. I think we were going to sit for the panel discussion, but I'm afraid that people back there won't be able to really see us if we do that. Would you prefer if we stand up for you? Do you guys mind standing?
Yes,
Okay, so I'm going to start out with a question, and then maybe you guys can ask me a question, and we'll see if the audience has questions, and we'll just sort of go. So I think my question for both of you is, we've talked about there's so many different types of uncertainty around diagnosis or prognosis or treatment. What has been, is there one time or one type of uncertainty that was the hardest for you? And maybe how did you get through that time?
I think for us, the most difficult part, as I pointed out, was really right at the beginning of not knowing, if he would continue, if he would survive the whole situation. I think that's probably the worst possible outcome that anyone thinks about. And beyond that, then there's things. I think there's always hope as long as there's something you feel you can do, and maybe that thing is not, that you're going to cure your child, but at least if there's something you can do to make things better, to make them happier, to make them more comfortable. But certainly in that initial moment for us, that not feeling there was anything that we could do, and just having kind of no grasp at all around what might be going on.
I think for me, it's been that changing ground. It's like every time I think I get a foothold, it just drops. And I think, although, as I said, I see a lot of poetry in that, and I think that's kind of how I've dealt with it, is to see, I think sometimes a challenge produces beauty. And, but I think the flip side of that is like the very practical part of myself that used to be very type A before my little girl came along and kind of blew everything open. That how do you plan? The poetry is all well and good, but how do you plan for all of the possible futures? How do you simultaneously prepare a little girl that you hope will, even though it seems so unlikely, that you hope might someday live on her own, might have a career when some brilliant person comes up with a technology that will let her communicate and she's going to be some kind of like wild coder and change our world, or a child who I will possibly outlive. And how do you plan for all of those futures all at the same time and not have regrets no matter what happens? And I think for me, every time I dig into the realities of, do I stay home with her and spend every moment I can, or do I go to work and try to make money so that she'll have money when I'm gone? The practical pieces are really hard.
I think I see parents not flip-flop. I see parents try to stay in the moment and appreciate the joy and the beauty in each moment, but then also try and plan for this future that has so much uncertainty and the struggle and that tension between staying in the moment and enjoying the precious, beautiful time and trying to, at the same time, plan for that future that's so unknown. So I said I would try and answer questions. Let's take one from the audience, and then you can ask me a question.
Thank you for sharing. And talking about the coping mechanisms, one of the things you talked about was affection. And I'm just wondering about your extended family, thinking about the grandparents and others, your siblings perhaps, how they were most helpful, or presumably they were helpful, but if there are suggestions you could make to those folks who love you.
I think for me, the thing that I want is for people to stop asking me what I need and just give it to me. So, to just show up with food, to just, show up with coffee. I have a friend, for instance, who's just in the hospital. She couldn't leave her bedside of her son, and all she wanted in the world was dirty chai from Starbucks. And so I spent 3 hours on the phone, literally 3 hours on the phone, trying to get her a dirty chai at her bedside, because I could get it to the downstairs. I could pay for it over the phone with a credit card. But I couldn't get it up the stairs to her. I finally found it. It cost me $40. It was a $40 chai, but it was totally worth it, because it gave that woman, who is a very dear friend, who is dealing with a very fragile son, the chance to just make it through the night a little bit more comfortably. And so I think that's sometimes I don't want people near me. I feel like I might crumble if someone is too nice to me. So sometimes just showing up with something and then disappearing. And also I think giving people the chance to talk about the things that are really scary and not just say, you're strong, you'll do it, or it'll be okay, but to actually say, no, this is horrible. This is just horrible.
Yeah, I mean, just adding to what Hilary said, and certainly, my parents and my husband's parents have been very supportive. I think, being there but not necessarily showing pity, at least for me personally, that makes a big difference of just being there, being helpful, being around. Maybe someone needs more help than they would otherwise, but sometimes it's important to not let that aspect of your relationship, with your child or grandchild, define the whole thing of, what would you do if things were otherwise? That you'd be, showing up and playing with them or what have you. That some of it is just still goes on as normal, so that it's not always dwelling on, that there's this big horrible issue going on.
What do you guys, should we take another question, or do you want to ask a question?
I mean, I'm just for you, Kim, in terms of being in a medical profession, and I certainly, I'm sure most people have entered into this, there's, thousands and thousands of these rare diseases, and most experts even have not seen more than one or two in a situation. How do you deal with the uncertainty that you have, and appropriately engaging with patients when you might not even know, even with a diagnosis, what the future holds, and what the disease really involves?
I think maybe what I would say is to parents is that doctors are people too, and we grab onto coping mechanisms that we know. We default to the places that we feel safe. So sometimes when you see physicians seem unemotional or removed or angry, or we don't have all the answers. So especially for a child who's undiagnosed, we are supposed to be the authority. We're supposed to have the answers. We're supposed to know what the next steps are and be the guide for a family. And when we don't have that, you have to be a pretty self-aware person to be able to acknowledge that and deal with it, so that you don't bring that into the space with the family and the child. I think there's also a lot of emotion that goes back and forth. I think very frequently the thing that doctors do that they really need to be taught not to do is they mirror whatever emotions in the room. So if a parent is angry, the physician will mirror that anger. If a family is sad, they'll mirror that. Or if there's frustration. So if a family comes in frustrated and they say, oh, I don't have a diagnosis, I'm so frustrated, what's going on? Instead of the doctor sitting back and saying, tell me more about that, tell me what's making you so frustrated, tell me how we could support you through that, just sort of talk to me about it. Sometimes they feel like you're coming in and saying, fix me or solve this, and instead of just sitting back and listening, the doctor responds with frustration. And what to know about doctors, we're problem solvers. We're not really wired to be listeners, we're wired to be problem solvers. So when you need a doctor to listen, you have to sometimes say, stop and listen. Like right now, I want to solve this problem, but right now I just need you to hear what I have to say.
So just one quick follow-up on that. What's the best kind of way to engage a doctor to give you information even if they're uncertain? Because I think, many professionals are wary to provide information if they don't know something for sure, but they might be able to direct you generally. What's the best way to kind of ferret out what information might be known even in an environment where the expert is uncertain?
Yeah, I think in palliative medicine, one of the first questions that I try and ask people who I'm working with is, how do you like to receive medical information? Because there's such a wide range, and as a doctor, like for some people, if I give them lots of details about what I think is going to happen with their child, and they maybe aren't all positive, for some people, hearing all of that just it crushes them and they shut down and they say, how could you have done that to me, doctor? And for other people, that is like, oh, it's such a relief. Somebody finally is being honest with me. So the position that I think doctors are in is you have all these people who want to get information in different ways and want a different amount of information. So I think if you start out with, look, I like to get information in a really direct way. I am okay if you use medical jargon. I will tell you if I don't understand it. I know that you might there might be things that you think I don't want to hear because they're hard to talk about. But if I'm going to cope with this, I need to know all the bad and all the good. And if you don't know an answer, that's okay with me. I don't expect you to have all the answers, but if you can even any resources. So I think sometimes if you're just really explicit about how you like communication, then the doctor will adapt to that. Okay, you want to do another question?
My name is Betty Ann, and I'm a member of the LIMS community. I'm a patient advocate. I suffer from LIMS myself, which is Lambert-Eaton myasthenic syndrome. It's very rare, and it's usually diagnosed in adults later. Some young, Dawn, how old were you, sweetie?
I wasn't diagnosed until 2 years ago, but I had it as a young child.
Okay, I was diagnosed at 75. So this is an older. Now, your presentations were wonderful, but they were directed from the caretakers. Now, no diagnosis and no prognosis coming, which was with me for about 5 years before finally a neurologist who was adventuresome gave me the blood test. So all this stress, all those years, and what's wrong with me? I can't walk. It's a neuromuscular disease. We haven't talked about the patient's viewpoint on surviving with no diagnosis. I knew something was wrong. I was a dancer growing up. All of a sudden, I can't walk, I can't stand up, I get all these things, but nobody could find anything. So the frustration that's involved when you're in, some of you in here may have been in that situation, when you're in that situation, what is wrong with me? The same kind of stress things go, but personally on a different level. So somehow I think we need to address that. Because some of these diseases don't come about until you're in your 50s, or we have 12 members of our community here this week. Most of them were diagnosed in the 50s maybe, or 60s, but had been for years without any diagnosis. Now the prognosis is they found out what is wrong with me. The prognosis, we don't know. Well, you could die tomorrow for all we know. There's no research being done. So I think we do pretty good staying happy and whatever, but that's a stress. And I think that needs to be introduced, that needs to be discussed from the standpoint of the patient. For the oldest, for the older patients with rare diseases. I mean, what are there, 10,000 in the world or something? I don't know.
No, less than there's 350 of us in the U.S.
So it's interesting to take what you've all talked about, which was wonderful, but from an adult standpoint, as the patient, not the caretaker.
And
Yeah. Oh, go ahead.
I think
Sorry.
that's so important. Like, I know that for me as a caretaker, part of my job is to try to put myself in my daughter's position, which is very, very difficult. And so I always feel really touched when I have the chance to talk to someone who has dealt with things that are similar to what she's dealing with, and trying to say, okay, can you tell me, how do you experience this? How do you feel in this situation, so that I can extrapolate more? And I think that you're absolutely right. It's so important to make sure, and I think especially the caregiver groups, we can be really gung-ho, and sometimes we miss that piece.
Yeah, and my training background is family medicine, so I take care of people all ages, and we did sort of skew toward undiagnosed children, but I completely agree with you, and next time we do a panel, we should have somebody who's actually experiencing the uncertainty from the point of view of themselves and their disease. And I think that would be wonderful. I think some of my motivation in doing this was just to get people to start talking and raising it as issue, and we don't have the research to show what are the tools that help people get through it, but they're out there. You know, it's all through surveys. You know what's helpful, and can we start sharing that as a community?
Also, as an older adult, my daughter would be my caretaker. She needs to know what to do, but I have to teach her.
Mm-hmm.
You know, because she's not had to take therapy as, these sweet little kids who can't take care of themselves.
Do you want? What do you want?
Do a few more. How are we doing for time?
I think we're actually at our last 5 minutes. Maybe we can take one more question and then do our sort of takeaway points and see if you guys have some takeaway points, and that may be all we have, and then we'll stay and we can talk some more. Okay, we will close. Oh, so this is the quote, and maybe you have to tell me, maybe this isn't a good quote, because you said, but you're braver than you believe, and stronger than you seem, and smarter than you think. So, do you want to do one more question?
We do.
Thank you so much for your time. I'm coming at this from both sides of your table. I'm a family doc, and I'm also a mother who has a child with rare genetic disease. And so I feel like as a mother or a clinician, there's a lot of pressure on me to try to fix this. And my question for you as a provider and also you as a mother, what are some ways that you have been able to rejuvenate your soul to not feel so crushed by that burden?
I think that is the perfect segue, because I think that's how we wanted to wrap up, is go through maybe our pearls of what's helped us, and then hear the takeaways from you, so that we don't miss the wisdom that exists in the audience. So I know, do you want to start?
This was me. I made a slide so I'd remember. I think some of these things I already mentioned, just in terms of the unknown, allowing you to just not limiting what you think is possible. I mean, certainly by no means is James, advanced. He looks great in pictures, but he's nonverbal. He's in diapers. He doesn't understand any spoken language. He cannot dress himself, feed himself, any of those things. But he still has achieved amazing things, particularly for what they thought was possible. So I think finding the positives, focusing on the quality of life, thinking about what you can do, and giving them the best quality of life possible, of things they enjoy doing, people they enjoy being around, and keeping that forefront. There's certainly, if there's treatments or things that might benefit them, that's great. But I've known people who have focused on, say, trying to get their kid 40 hours of therapy a week, or as much therapy as possible. I wouldn't want to do that. Why would you put your kid through that? They need downtime. They need fun time, hanging out, doing whatever it is that they enjoy doing on their level. So, always keeping in mind, and I think with your question, but what if it was you? I mean, so even us as caregivers need to think about, if that were you, what would you want to do? And just, you want them to have a happy life above all, within whatever that is. And so, really keeping a focus on that, and thinking about what they can do, helping them do that, and really having the best outcome. And the last point, it's a marathon. You can't be expected to do everything the first day. You have to have your own life still, and keep plugging away. And I think the reality is, and Hilary mentioned this too, there's a number of the things that, we're working on with the foundation that realistically probably will not help James. He's 13 and the things take time, but, thinking about what you're doing for other people, for, their legacy and what their purpose is here, making other people happy, providing, whatever they can teach those around them, their siblings, what have you. But there is, it's a long road, and thinking about what they can contribute even within the given situation that is what it is.
So for me, to answer your question about not being crushed. I think it's okay to just let yourself be crushed and to be okay with that. And for me, that's kind of how where I've found my strength, is to say, my background is in communication rhetoric. I have a PhD in communication and rhetoric. And so for me, communication is how I've stayed alive and sane for the most part. I started writing about Esme on a blog when she was about 18 months old. She was seizing constantly at that point, so she would have 15 seizures in about a 24-hour period, and then she would be sick for a day kind of before it happened, and then we'd have a day of seizures, and then we'd have a day and a half of recovery, and then the cycle would start again the next week. So we would spend 4 days in my bed with her and her oxygen tank and the rescue meds, and I would hold her, and I'd try to breathe really shallowly, because if I disturbed her, she would wake up and have a seizure. And I would write with one hand, and I wrote all of the ways I was broken and suffocating, and I've taken the same approach with our doctors. I've said, I'm drowning. I don't know what to do, and I've tried to. I noticed in myself that there were times that I held myself so tightly that I thought I would shatter. So I started to try to bend a little, and to be okay with saying when I was overcome. And I was saying to someone coming to an event like this, I have 2 speeds. It's like stiff or crying, because it's a lot. And I think that to expect that we cope, and it's interesting, Kim and I talked about this a little bit beforehand, that the advice to take time for yourself and things like that. People tell me that, and I want to flick them, because I don't have time for myself. I have to do other things, and so I think it's to me it's kind of like embracing and communicating the reality of being crushed and wrecked and powerful at the same time, and just some people don't like that metaphor of fighting, but just the constant, like, I'm going to make things different. I don't know how. I don't know if it's this afternoon I'm going to make Esme smile, or if it's in 2 years I'm going to get her diagnosed, or if I'm going to write an article and I'm going to hear from a mom who says, I was losing it today and I read your article and I feel a little less alone. So I don't know how helpful that is for actual prescriptive takeaway, and I think everybody's so different, and that's just what's worked for me. Everybody needs something different, I suppose. But yeah.
We are out of time, so I want to respect all of your schedules. But the last thing that I will say about maybe what I have seen from parents and families and patients who I've taken care of is the ones that can find meaning and purpose are the ones who end up having the most joy and fullness in their lives. And that may be doing something like you two have done and creating these foundations, but it can be very simple. Like, my child has taught me patience. My child has taught me to be in the moment. My child has taught me to stop and smell the flowers and enjoy the simple things in life. And I see them give that gift to all these other people. I see my child touch the hearts of the people who come into contact with them, and that is my purpose, and that is my child's purpose. And so for everybody, you have to find what that meaning and purpose is. But I think the other thing that's helpful for me is sort of the mindfulness. And sometimes we're in the future, and sometimes we're in the past, but having times during the day when we're just in the moment and focusing on the beauty of the trees, or the wind in my face, or my child's smile, or I think for me, that's the way I can just take a breath. And not that I am in any of your experiences, but that's probably when I come out of a room and a family's having a hard time and there's been lots of emotion. Those are the tools that I use. So I'm sorry we don't have time to hear all of your wonderful strategies that you use, I think, to cope, but I think we better let you all go on to your next sessions.
Could jump on the app and review this session, that would be excellent. At this time, we ask you to go enjoy our networking lunch sponsored by Alnylam Pharmaceuticals, and our next breakout session begins at 2 p.m. Thank you, everyone.